Yes, let's start with identification of this muscle. Which muscle is this? Pectoralis major muscle. Okay, a large muscle covering the chest wall. When I cut and reflect this pectoralis major, I identify this muscle. This muscle is pectoralis minor muscle. Okay, so when I reflect the pectoralis minor muscle, the region of axilla is exposed. And axilla, we know there are branches of the brachial plexus. Let's try to identify them. Which nerve is this? This is the musculocutaneous nerve. Okay, we can see this nerve, it is piercing this muscle. This is the coracobrachialis muscle. So this nerve is musculocutaneous nerve. When I trace the musculocutaneous nerve upwards, I'll reach the lateral cord of the brachial plexus. And once you have identified the lateral cord, there is one more nerve. One more nerve from the lateral cord is this. This one is lateral root of the median nerve. Okay. And lateral root of the median nerve is joined by the medial root of the median nerve. So that forms this median nerve. Okay. Okay, so medial root of median nerve, when I trace upwards, there is the medial root of the median nerve. Medial cord of the brachial plexus. The largest branch from the medial cord is this. This one is the ulnar nerve. Okay. And here we can see a M pattern of the brachial plexus. One limb of M being formed by the musculocutaneous nerve. Then there are two roots of the median nerve. And then this is the ulnar nerve. Okay. So it forms an M in this region. Then behind the median nerve, I can see this artery. This one is the axillary artery. Okay. And behind the axillary artery, there is a nerve, thick nerve that I can see here. That's the radial nerve. Okay. This one is the radial nerve. Okay. When I find the radial nerve, I go behind. I reach to the posterior cord of the brachial plexus, and from the posterior cord, this nerve is seen, axillary nerve, going towards the surgical neck of the humerus. This one is the axillary nerve. Okay. Then one important branch of axillary artery is seen here. This branch is subscapular artery. Okay, a branch from the third part of axillary artery. Okay, axillary artery has got three parts divided by this muscle. This muscle is pectoralis minor. Above it is the first part, behind it is the second part, below is the third part. From the third part, there is one branch, and this is the largest of all the branches. This is the subscapular artery. Okay. And what is the branch from the first part of axillary artery? Superior thoracic artery. And branches from the second part are acromia thoracic and lateral thoracic. Third part is subscapular. Then anterior circumflex humeral and posterior circumflex humeral. Okay. Then I can see one nerve here along the chest wall. Okay. If there is nerve running vertically on the chest wall, which nerve is this? The long thoracic nerve. Okay. Arises directly from the roots of the brachial plexus. Then let's identify muscles of the anterior compartment of the arm. This muscle is biceps brachii. Coracobrachialis we have already identified. And one more muscle in the arm is this. This one is brachialis muscle. Okay. So three muscles in the anterior compartment of the arm, all supplied by musculocutaneous nerve. Brachialis has got some supply from the radial nerve as well. The lateral part of brachialis, little part is supplied by the radial nerve as well. Okay. So three muscles in the anterior compartment of the arm. Then this large muscle that is seen surrounding the shoulder, this is the deltoid muscle. And there are other muscles of the musculotendinous cuff or rotator cuff. Those are seen when we dissect from the posterior aspect, the supraspinatus, infraspinatus, teres minor, subscapularis, teres major. Okay. And in the arm, posterior compartment, there is one muscle that we can see here. This is the triceps brachii muscle. Okay. Triceps brachii muscle. So when I see the posterior aspect, there will be three heads of triceps brachii. Okay, there is a long head of triceps arising from the intraglenoid tubercle. There is one lateral head, and there is one medial head of the triceps. Okay, three heads of the triceps, and triceps brachii is supplied by which nerve? Radial nerve. Okay. Now let's see the region of cubital fossa first, then we'll cover the forearm. So this region here, that's the cubital fossa. What are the boundaries of cubital fossa? Laterally, there is this muscle. Which muscle is this? Brachioradialis. Medially, this muscle, pronator teres. Base is formed by an imaginary line connecting the two epicondyles of the humerus. Okay. Roof we have removed, which has skin, superficial fascia, deep fascia, and superficial fascia is the veins. Laterally there is cephalic vein, medially there is basilic vein, and they are connected by median cubital vein. Okay. And so side boundaries we saw, roof we saw, then floor of cubital fossa is formed by two muscles. This muscle is, no, this is again brachialis, the muscle we identified here. That same muscle forms the floor of cubital fossa, and also one muscle along the lateral aspect of the radius, winding around the lateral aspect of radius. This muscle is supinator muscle. Okay. So two muscles forming floor of cubital fossa, brachialis and supinator. Okay. Then contents of cubital fossa from medial to lateral. MBBR, median nerve we had identified in the arm. Just trace the same median nerve down. Medial most content of cubital fossa is median nerve. Then there is this brachial artery. Okay, this artery that we can see, brachial artery. And there is tendon of this biceps brachii muscle. And there is a radial nerve. So for radial nerve, we have to retract the brachioradialis muscle. Then we'll see that. Okay, this nerve I can see now. That's the radial nerve. Okay. So four contents in cubital fossa from medial to lateral are median nerve, brachial artery, tendon of biceps, and the radial nerve. Okay. So this was cubital fossa. Let's move to the forearm. So forearm flexor compartment has got 5 superficial and 3 deep muscles, and all superficial muscles are arising from this part of the humerus, medial epicondyle of the humerus. Okay, arising from medial epicondyle, going laterally. First muscle to identify is this pronator teres that we had identified. Then this muscle is flexor carpi radialis muscle. Then this muscle is palmaris longus muscle. Okay. Then this muscle is flexor digitorum superficialis, and the medial most muscle is flexor carpi ulnaris. Okay. And all muscles are supplied by median nerve except this flexor carpi ulnaris, which is supplied by ulnar nerve. So when I retract this flexor carpi ulnaris, I can see a nerve deep to it. That's the ulnar nerve. So, okay, so ulnar nerve supplies this muscle. And how to identify median nerve? Median nerve in the forearm has to be identified deep to flexor digitorum superficialis muscle. Okay, when I reflect this flexor digitorum superficialis, I'll find the nerve deep to it. Okay, this nerve is median nerve. Okay, so median nerve supplies these four superficial muscles, and it also supplies the 3 deep muscles by giving a branch called as anterior interosseous nerve. Okay, so anterior interosseous nerve will run in front of the interosseous membrane, and it will supply the deep muscles. And which are the deep muscles? Name them. The medial muscle is flexor digitorum profundus. The lateral muscle is flexor pollicis longus. And when I retract these two, the deepest muscle that I can see here, a quadrangular muscle, this muscle is pronator quadratus. Okay. And nerve supply of these muscles, I told you anterior interosseous nerve, but there is an exception, the flexor digitorum profundus muscle, medial half of which is supplied by ulnar nerve. Okay, because ulnar nerve we saw here, it is very close to flexor digitorum profundus muscle. Okay, so medial half is supplied by ulnar nerve. Okay, or else you can remember ulna is the medial bone of the forearm, so medial half of profundus is supplied by ulnar nerve. Okay, make sure you remember medial half is supplied by ulnar nerve, lateral half is supplied by anterior interosseous nerve. Okay, so we have seen 5 superficial and 3 deep muscles of the flexor compartment. Let's see the extensor compartment now. Extensor compartment muscle, first bony landmark you need to identify is lateral epicondyle of the humerus. This is called as common extensor origin. Okay, and just in front of the lateral epicondyle we can see these muscles. The brachioradialis muscle is included here, one of the boundary of cubital fossa, right? This muscle actually arises from the lateral supracondylar ridge of the humerus. Okay, that's why we are not able to trace it towards lateral epicondyle. This muscle is arising from lateral supracondylar ridge. This muscle is brachioradialis. Then there is extensor carpi radialis longus and extensor carpi radialis brevis. Okay, these 3 muscles to be remembered together: brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis. Then there are 3 muscles to be remembered together. One is extensor digitorum, then there is extensor digiti minimi, and extensor carpi ulnaris. Okay. Make sure you remember these three muscles together: extensor digitorum, digiti minimi, and extensor carpi ulnaris. Okay. And one more muscle is left here. This muscle is anconeus muscle. Okay. This is the olecranon and this is lateral epicondyle. Between these two bony landmarks, just find a triangular muscle down. That's the anconeus muscle. Okay. So you have identified 7 superficial muscles. Okay. 3 in this lateral group, 3 in this dorsal group, and 1 anconeus. Okay. And all muscles are supplied by radial nerve, but 3 muscles are supplied directly by the radial nerve, and remaining muscles are supplied by a deep branch of radial nerve called as posterior interosseous nerve. Which muscles are supplied directly by radial nerve? Yes. Anconeus, brachioradialis, and extensor carpi radialis longus. These 3 muscles are supplied directly by the radial nerve. Remaining muscles are supplied by posterior interosseous nerve. Okay, the deep branch of radial nerve. And let's identify the 5 deep muscles. In 5 deep muscles also, you have to remember one group of 3. Those are referred to as outcropping muscles. Okay. If you see the region of anatomical snuff box, this 2 muscles I can see on the lateral aspect. These 2 are abductor pollicis longus and extensor pollicis brevis. Okay. And there is one muscle separate. This is extensor pollicis longus. Okay. These 3 are the outcropping muscles. And there is one muscle going towards the index finger. Okay, this muscle, extensor indicis. Okay, we can see 2 tendons here going towards the index finger. So one tendon is of extensor digitorum and another tendon is for the deep muscle, extensor indicis. Okay, so 3 outcropping muscles and extensor indicis, and one is supinator that we had seen in the floor of cubital fossa. Okay. So 3 outcropping, extensor indicis, and supinator. These are the 5 deep muscles, and all of them are supplied by posterior interosseous nerve, the deep branch of radial nerve. Okay. And this 3 major nerves, when they enter the forearm, they pass between 2 heads of muscles. Okay. The median nerve, when it enters the forearm, it passes between 2 heads of pronator teres muscle. When the ulnar nerve enters forearm, it passes between 2 heads of flexor carpi ulnaris. And the posterior interosseous nerve passes between 2 heads of supinator. So basically radial nerve, one branch is passing between the 2 heads of supinator. Okay. Now let's see the muscles of the hand here. So muscles of the hand, there are 20 muscles which are divided in groups of 4. 4 thenar muscles, 4 hypothenar muscles. There are 4 lumbricals. And there are 4 palmar interossei and 4 dorsal interossei. Okay, let's start with the thenar group first. So in the thenar group, the lateral muscle, which we can see here, that is abductor pollicis brevis. Abductor pollicis brevis. The medial muscle is flexor pollicis brevis. And a muscle deep to it. When I retract this abductor pollicis, the muscle which I find here, this is opponens pollicis. Okay. And there is one muscle between thumb and the index finger. There is a muscle called as adductor pollicis. Okay, adductor pollicis muscle. So these are the 4 muscles in thenar group. I'll repeat again: abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and adductor pollicis. Okay. And what about nerve supply of these 4 muscles? Yes, most of them are supplied by median nerve. So this abductor pollicis is median nerve. Flexor pollicis brevis is supplied by median as well as ulnar. Okay. Then opponens pollicis is only median nerve, and adductor pollicis is ulnar nerve. Okay. Let's see the hypothenar muscles now. One hypothenar muscle we won't be able to see because it goes off with the skin. There is a muscle called as palmaris brevis muscle which is present just beneath the skin. And then this muscle on the lateral aspect is abductor digiti minimi. And this muscle is flexor digiti minimi brevis. Then a muscle deep to it is opponens pollicis. Opponens digiti minimi. Okay, opponens digiti minimi. Okay. And all these are supplied by ulnar now. Then we can see the lumbricals here. These tendons that we can see here, these are tendons of flexor digitorum profundus. So we can see some muscles, worm-like muscles attached to the tendons of these muscles. So these are lumbricals, okay? Vertical muscles which we can see arising from the tendons of flexor digitorum profundus. These are the lumbricals, okay? 4 lumbricals are there. The lateral 2 lumbricals, so the first and the second lumbricals are supplied by median nerve. The medial 2 lumbricals are supplied by ulnar nerve, okay? Then when we retract this lumbricals and go deep inside, then we'll find the muscles of palmar interossei. Between the metacarpals anteriorly is palmar interossei, and to see the dorsal interossei best we can see from the posterior aspect between the metacarpals posteriorly. So this interossei that we can see here, this is the first dorsal interossei between first metacarpal and second metacarpal, right? Similarly, there are other interossei muscles, okay? So dorsal interossei is best seen from the posterior aspect. And all palmar interossei, dorsal interossei, they are supplied by ulnar nerve, okay? So out of the 20 muscles, 15.5 muscles are supplied by ulnar nerve. Only 4.5 are supplied by median nerve. Okay, let's recap about this 4.5 muscles so that other nerve supply is clear. Which 4.5 muscles are supplied by median nerve? One is abductor pollicis brevis, opponens pollicis, these 2 muscles, and these 2 lumbricals, 4, and the flexor pollicis brevis half. The superficial part of flexor pollicis brevis is supplied by median nerve. Okay, so that's how 4.5 muscles are supplied by median nerve. Remaining all muscles are supplied by ulnar nerve. Okay. So this was about identification of all muscles along with its nerve supply. Okay, I'll stop here.